Hello, my name is Kevin Williams, and I serve as a psychiatric PA at On Point Behavioral Health in Tampa, Florida. Today, I want to thank you all for joining me for our last video of the series discussing a condition called tardive dyskinesia. Now today we're going to give some practical tools and tips that we can use starting tomorrow in our clinics to help really understand how patients are impacted, but most importantly, some of the questions that we can ask to help trigger some conversations that can elicit more dialogue around this condition called TD. Now, one of the most important things that we can do for our patients who are being treated with these dopamine receptor blocking agents, such as antipsychotics and antiemetics, is really to prepare them to discuss the movements at every visit. You know, prior to having the approved treatment option, I would discuss with patients about TD, or I would move quickly to discuss that I'm going to place them on this, but truly it was because we really didn't have appropriate medication. Well, now I feel confident in sharing that I'm going to start you on this dopamine receptor blocking agent of whatever sort, and that if it does cause for movements such as TD, that we have something that we're going to do. And what I've learned and I've seen is that it empowers patients to be looking for it. And now every visit, they're telling me, you know, Kevin, I haven't seen those movements you talked about, or, you know, I think I'm seeing it, or we even share with family what they're able to do to help us to be able to identify it. So empowering patients on the initiation of even starting that medication is so key to really gain the shared decision-making of not only starting something to treat potentially their mental health disorder, but also in case something does take place, such as a movement, that we do have something that can help treat them. Now, I kind of want to discuss some of the things that I do in my practice to really allow for the patient to feel engaged, to discuss their movement disorders. So we really have to ask some concrete and clear questions to our patients. And we have some questionnaires, and I'll share some resources with you towards the end of today's video to help you not only be empowered, but to be equipped to ask some questions. So I'll say things like, have you or your family noticed any abnormal movements or any involuntary movements? And sometimes they'll say no, or their caregiver or their family member will say, you know, I have seen. And then I'll ask them, okay, what I want you to do is I want you to, we'll do an AIMS in the office, but I want you, when you get home, I kind of want you to monitor this, and I want you to see. And if you do notice, I'm gonna ask for one of your family members, if possible, to record or to place the camera or your phone somewhere, if you have one, and take an asynchronous video and bring that or send that in to me so that I'm able to see it. Why? Because sometimes TD doesn't show up when they're in the office, but it might show up when they're relaxed at home. So allowing patients to not only be there, but also to see what takes place at home is truly key. We know that TD can affect patients socially, can affect patients emotionally, and even physically. And in a survey looking at over 435 patients, what we saw of the 187 patients who were working, 60% of them reported some form of impairment while working, and 15% actually showed some issue of absenteeism. 54% of these patients always or often felt sad or unhappy. 41% felt always or often limited to their social activities, all due to tardive dyskinesia. And then 63% reported some strong impact on their quality of life. So there is a need for us to check on our patients in regards to their mental health and even to their quality of life. Listen, I'm a firm believer that shared decision-making is how we should be treating every patient. And starting a patient on a VMAT2 inhibitor requires there to be some form of shared decision-making. Why? Because we do, and we have seen that we can drive their TD symptoms to remission, but it does require that they stay on that VMAT2 inhibitor to ensure that those symptoms don't return. And through treatment, allowing for the patient to not only understand their condition, but to understand that the medication can help them is so key for patients to feel empowered when they're outside of our office. So we need our patients to understand that symptoms are manageable, and our preference is to treat early, screen early, identify early, and treat early so that we can potentially gain remission. As I share with you, there are some resources that we have available to our disposal. On the internet, you have mind-t.com. Great resource, not only for us as clinicians, but also for patients and their families. You have the National Organization for Tardive Dyskinesia, tdhelp.org. And you also have another website called Talk About TD, talkabouttd.com. We are empowered as PAs to start treating TD tomorrow morning when we get back into the clinic. And let's get started closing that gap of the 60% of patients who are still undiagnosed, struggling with TD today. Thank you so much.